Welcome back. This is session 5 of this course on understanding and managing depression. I'm Dr. Traci. In this session, we'll explore the power of surrender. In the previous session, we talked about the importance of knowing who we are without the defense mechanisms, the judgment, the pain. And isn't that what depression really is? Pain, a reaction to life's painful experiences. So why then aren't we supposed to acknowledge it and feel it? Wouldn't it be common, normal even, for us to feel depressed when we experience a tragedy or a loss, a death? The answer is yes, it is normal. We all understand that depression is a very serious mental illness. However, putting this big, scary label on it makes it even worse. Even using the words mental illness makes many people feel like there's something wrong with them or that they're less than. This makes us want to fight it, to get rid of it. But how can we fight it and get better when in and of itself it strips us of everything we need to fight it? So the answer is we don't fight it. We learn to live with it. Now, I know that's probably not what you want to hear, but let me explain the reasoning. Given what I just asked, how can we fight it and get better when in and of itself it strips us of everything we need to fight it? It just doesn't make sense to fight it when we have nothing to fight with. And fighting it just puts us at odds with it. Since depression lives inside us, that means we're at odds with ourselves and can put ourselves in an internal conflict. I'm sure in your effort to get better, you've waged this war before. I know I have. And it goes a little something like this in our mind. I think to myself, that's it. I'm sick of feeling this way. I want my life back. So then I make goals for myself. I'm going to get out of bed and go work out. I'll go to the grocery store on the way home and get some healthy food to eat. I'll make myself a really good dinner. I'll take my dog for a nice walk. You know what? I think I'll meditate before bed too. Then I'll clean up and do some laundry. Then I fast forward about 3 hours later or so, and half the day has gone by. I have missed phone calls and text messages, and, maybe my dog even went to the bathroom on the floor because, you know what? I never took him out on that nice walk. Now, how do you think I feel? I feel worse than I did before because now I failed. I lost the war. I'm exhausted. I'm angry, crying. I'm disgusted with myself. I feel guilty, ashamed, helpless, hopeless sometimes. However, if we accept that we have depression, we can actually manage it better and even get rid of it completely. From a spiritual perspective, fighting anything attracts negative energy and negative consequences. So instead of fighting, we surrender. Surrendering does not mean giving up. It means we acknowledge its power and control over us so that we can work with the symptoms. We're acknowledging the power and control that depression has over us. It's a similar concept to the recovery process from drugs and alcohol. You must surrender to the fact that you have no control over the illness to then, ironically, gain control over your life. So what exactly are we surrendering to? Again, I want to be clear. It does not mean giving up. We're surrendering to the fact that we have no control over depression. This way, we learn to work with it rather than try to fight it. Let's discuss some examples of what this would look like in our day-to-day life. Grab pen and paper and make a note of which examples could work for you. If you don't already have that pen and paper, you can go ahead and pause the recording and come back when you're ready. I also want you to come up with your own examples so you can start thinking outside the box, getting away from the cognitive distortions and start problem solving. Depression takes away our ability to problem solve. I'm going to give a lot of different examples, which can be overwhelming. You're not expected, nor it's not even advised that you implement all of these, especially at the same time. Though the depression really wouldn't allow us to do that anyway. Working with depression is about checking in with yourself at any time and asking, what can I do today? What am I physically and emotionally able to do? If it's nothing, then you do nothing. Nothing but take care of yourself. If it's something, then choose what that something is and what it looks like just for that day. Tomorrow may be different. Here's some examples. Depression often causes fatigue, exhaustion. Plan your days around your sleep patterns, your level of energy, and level of even attention and concentration. If you're better in the morning, do what you can in the morning and give yourself permission to slow down and take care of yourself in the evenings. And vice versa if you're better in the evenings. Another example is if you need a nap, then take one and plan it into your day. Give yourself permission to do it so you don't feel badly about it when you do it. Another example, since doing anything is a challenge with depression, figure out ways of simplifying your life, such as order groceries for pickup or to be delivered. Cook easier meals or buy pre-made meals that just need to be heated. Order what you can online for delivery. Maybe divide up chores and errands amongst other people in the family or in the household. Schedule telehealth appointments when possible and have prescriptions mailed to you. You can even put things on auto renewal, maybe even set your bills for auto pay. Don't volunteer for extra responsibilities and ask for help. Take a day off when you need to and give yourself permission to do whatever you want, whether you want to sleep or just be alone, or maybe you want to schedule a self-care activity like a massage or going for a hike or planning some quality time with people you enjoy being with. Now, I understand that all of this may not be possible for you, but I'm sure some of it is. Take what works for you and leave the rest. Start to think of other ways to simplify your life. Just remember, when depression wants to take hold of us, it will. If it doesn't want us to go to work, we won't go. If it makes us want to be alone, then we'll be alone. So we have two choices, the way I see it. The first, feel badly about ourselves when this happens, feel like a failure, and allow depression to take over us even more. Or we can acknowledge that it's there and give ourselves permission to take care of ourselves. Now, what was once seen as a failure is now self-care and self-love. It can be complex to balance what we can and can't do each day, and be careful not to use depression as an excuse not to do something. Remember, this is about finding ourselves and being true to ourselves. Really check in with your authentic self and ask what you're capable of doing that day. There's a big difference between not wanting to do something and not being capable of doing it. And only you have the answer to that question. Just make sure to check who you're asking and make sure it's the truest part of you. For your therapy homework, I want you to practice the divinity of surrender. When you feel sad or mad at depression or at yourself because you're unable to do what you want to, let go. Let it all go. Breathe. Relax all of your muscles. Put out your hands in front of you, palms facing up, as if you're giving something away. Because you are. You're giving away control. The control that you've been trying to have over depression. Visualize giving up that toxic energy. Say a mantra to yourself or out loud, something that works for you, like, I surrender, or just let go. You can say, give it to God. If you're feeling a little sassy one day, you can say, it's all yours, universe. Or, I'm handing this over to you, my angels. And one of my favorites, Jesus, take the wheel. This is the end of session 5.